Hello and welcome to our special show, Coronavirus Facts versus Myths. I'm Gargi Rawat. This is the show where we get you all the latest on the pandemic. The United Kingdom, which has been grappling with a new, reportedly more infectious variant of coronavirus, has now detected 2 cases of another new variant of COVID, this time from South Africa. The cases in London and northwest England are contacts of people who travelled to South Africa, where the variant was discovered. Travel restrictions with South Africa have now been imposed, and the variant has been causing mounting concern in South Africa, where the health minister even warned that young, previously healthy people are now becoming very sick. So alarm over this new variant. Now, Matt Hancock also said that AstraZeneca had submitted a full data package about its COVID vaccine to the medicines regulator, the next step in its journey to approval for use. Remember, the Pfizer-BioNTech vaccine was the first coronavirus shot to be authorized for use by the UK's independent medicines regulator and has been given to 500,000 of the country's most vulnerable people already since its rollout last month. So the AstraZeneca vaccine also applying for that emergency use authorization. Well, to talk about all these developments, we're now joined by Dr. Veer Pushpak Gupta, the national member of the National Health Service. Thank you so much for joining us again. And, we were nearing the end of 2020 and we were hoping that, the good news was about the vaccine. The vaccinations have started. But then comes this news of the new variant in the UK and now the news of the South African variant, which 2 cases also being reported in the UK. Tell us the latest.
Yeah, thank you for having me on the show, Gargi. Look, I don't think that we should take this as a negative news. I think this is a fantastic achievement for science that our nations, the United Kingdom, South Africa, are able to get this information out so quickly to the WHO, to the rest of the world, so that we are tracking this virus in real time. And I think with the help of information, technology, and the spread of news through social media, we're able to get this information to different countries, and then countries can take adaptive measures like they have done in terms of banning travel and things like that. So I think this is a good thing. But of course, it's concerning because this new strain has been seen to be much more infectious, up to almost 70% as infectious as the original one, and even more than the one that was discovered in the UK. And, there were 17 mutations in the UK strain. There are even more mutations in this particular strain, and they all aid in the virus becoming more and more infectious. And you can see that in the numbers in the UK. There were 40,000 cases in the United Kingdom yesterday, 780 deaths. So you can see that this is a ongoing problem for the United Kingdom, especially because, as you mentioned, it's affecting younger people. And so the working population has now been affected by this. And that's why Matt Hancock came out and said that it was a concern. But yes, there is a positive thing on the horizon. The vaccine, as you mentioned, the AstraZeneca Oxford vaccine that we've been waiting for so long, seems like it'll be approved by next week. And that's a huge news for India, especially because that's the vaccine that's going to be used by the Serum Institute to vaccinate people in India.
No, absolutely. That is great news because we were hoping that it would get cleared in the UK by Christmas time is what was earlier being speculated. But coming back to the 2 variants now, we do know that the UK variant so far, what we've heard from the scientists and researchers is that while it's more infectious, it doesn't cause a worse illness. It's not more deadly than than what the coronavirus that we're used to. However, the South African variant, as you mentioned, that is more concerning because of what the health minister said in South Africa, where he warned that even young people were, getting badly affected by this new strain of the coronavirus.
Yes, and look, it's too early in any scientist's opinion to know whether this is going to cause an increase in morbidity and mortality of patients that have been hospitalized. I think there needs to be specific studies done for both of these variants to know that. And so far, we don't have any evidence of it being worse in terms of mortality and morbidity compared to the original strain. I think what the South African government was so alarmed about was its rate of spread in younger people. But we also have to remember that younger people have less comorbidities, they have less health conditions to worry about, and so their survival in hospital and their morbidity in hospital is decreased in that extent. Of course, if this strain turns out to be one that can increase the risk of the patient within the hospital, then I think that's very concerning. But so far, I don't think that that's the case.
All right. And Some have also pointed out to how the research in the UK has been so robust in terms of, checking these strains and studying them. And it's very possible that these different variants are, already there in other countries. It's just that UK has been faster in actually finding it.
Yeah, absolutely. I mean, there's a lot of panic in different countries, but has anyone actually gone and studied these strains in various countries and seen whether there are different strains present in the population? I'll give you an example. There was a study done in Spain during the summer, and they found that there was an entirely new strain that was affecting patients in Spain, especially tourists that were in Spain during the summer, than the one that they had originally seen. And now there's a different one in the UK, a different one in South Africa. I think as more and more countries and labs around the world start to actually look at this virus, they will see that the virus is mutating faster than we think. And it's all about survival of the fittest. I've explained this before. Just like humans, have this survival of the fittest instinct. That's how viruses and bacteria are basically built genomically as well. So I think we just need to be on top of this and make sure that the information is spread to the rest of the world in real time.
Right, and continue with our COVID culture of, social distancing and wearing of masks and generally being very careful when out and about. But tell us about the AstraZeneca vaccine now that they've applied for that emergency use authorization, submitted its data. What happens now? If you could, share a bit about the timeline, the procedure there in the UK.
Yeah, look, if next week they give the green light to the UK, I think this is going to be a game changer. I've said this before. It's 2 to 3 pounds per dose to the British government. That's how much the AstraZeneca and Oxford is selling it at. And it's also going to be sold in India. So India and UK will be the first two countries to get this vaccine. And it will be a mass production vaccine. It will be stored at very low temperatures, at -2 to -8 degrees, which will, again, be stored very easily in any GP practice or primary care practice around the United Kingdom. And I think that's going to be the key difference, how the availability of this vaccine to the frontline practices with ease is going to be the difference, because that will make it accessible in a faster way. And also, the dosing. I think the important thing that AstraZeneca need to clear to the frontline practices and the doctors is, what is the dosing of this vaccine? Because as we know, during the trials, there was 2 different dosing seen. The first dose that was given to some patients as half dose saw better results than 2 full doses. So I think just that, if that confusion can be cleared up by Oxford and AstraZeneca, which hopefully they will do in the coming week or so, then I think it will be a game changer.
Right, absolutely. And as you said, this is the vaccine that we're looking forward to here in India as well. So hopefully it will be cleared by next week, as you say, in the United Kingdom, and then we can expect it to be cleared here in India very soon as well. Thank you so much, Doctor, for joining us again on all these new developments that we're seeing at the end of the year.
Thank you, Gargi. Thank you for having me.
Thank you. Now, the new coronavirus variant has emerged as the United States is grappling with a nationwide spike in infections that has added more than 1 million new cases in just 6 days, according to the Reuters tally, a total of more than 18 million since the pandemic began. Many U.S. states and cities have imposed lockdowns and business closures to try and get a handle on the wave of illnesses driven by last month's Thanksgiving gatherings. Political leaders have asked Americans to stay home for the upcoming holidays to prevent a surge upon the surge threatening to overwhelm the healthcare systems. Meanwhile, the Center for Disease Control in the U.S. has said that this new strain of coronavirus may already be there circulating in the United States. And Joe Biden has said that more challenges are there ahead. Well, to talk more about the situation in the United States, we're joined by Dr. Amitesh Anand, microbiologist, University of California, San Diego. Thank you so much, Doctor, for joining us. Now, the Center for Disease Control has warned that the UK strain may already be circulating in the United States undetected. What are the fears around that? Because so far the US has not been one of the countries that has banned flights from the UK.
I think US has never done good in terms of COVID-19 control. So even this new variant that has come into the country, I don't think there is going to be any difference in terms of what all measures the country is taking. And they are not right now banning any travel or anything. But what many states have done is that we are in stay-at-home order. At least, I'm in California here, we have to be in the state. And if we are traveling from outside the state, then we have to undergo 14 days of quarantine, and we have to go and get tested for COVID.
And, the vaccination procedure is underway in the U.S. In fact, you have two vaccines, Moderna and Pfizer. Now, people, however, in the U.S. are hesitant about the vaccine. You have big celebrities taking vaccinations. The doctors have been tweeting their pictures. And is all of this effort making any difference?
Well, so there are two things. One is that I'll say people in the US are not no different from people anywhere else. Everyone has a little bit of apprehension about these vaccines, especially because they think this vaccine has been developed in a very short span. So I don't know how safe it is. But the good thing is that we have safety data and everything, which indicates that it's really a good vaccine. Having said that, yes, there is a small group of people who are not very much into vaccine, and they are a little reluctant, and they are becoming vocal also about not taking vaccine. But as you know, like President-elect Joe Biden, Dr. Fauci, who is kind of a voice in US for coronavirus control, so they are taking this vaccine, and many other celebrities have taken the vaccine, and that is really, really sending a positive message to entire population.
And Doctor, also, recently the U.S. added 1 million cases in just a matter of under a week, in around 6 days. What is the main reason that you're seeing such a massive spike in the numbers, given what we already know about how to control the spread of the disease?
I think one problem that has happened is that after about 8-9 months, people have kind of become reluctant towards all the measures that they have to take. Having said that, majority of the population is taking all the precaution, like they are wearing masks, they are maintaining the distance. One reason why we see those large number of cases in US is that in US, testing has become very, very convenient, and like you can just walk to the store and get tested for free of cost. So testing is one reason why we see lots of cases over here. I'm not saying that it's a good thing, it's a bad thing, but then I'll again say that other countries probably are not doing equally well in terms of testing. If they do so, they will also have similar proportion of this virus, because by now this virus has penetrated within the population.
And most worrying is the situation where you are in California, where the reports that they're even running out of ICUs, and appeals to people to not go and celebrate during Christmas.
Well, yes, you're right. There is the situation is really, really bad. Most of the hospitals are on the verge of saturation, which I mean that I think almost 80 to 90% of the hospital space or the number of beds are already occupied. So if things go worse from here, then situation will be like really critical. And in terms of California measures, we are under a stay-at-home order. We have to avoid traveling out of the state, and obviously all the necessary measures like wearing masks and everything is being enforced very strictly.
All right, Dr. Amitesh, thank you so much for speaking to us here at NDTV. And from the US, let's now focus on Germany. And Germany reported 962 deaths from coronavirus on Wednesday, the highest daily toll since the beginning of the pandemic. The nationwide lockdown, which began on the 16th of December, has helped to prevent exponential growth in new infections, according to experts. But the 7-day average remained above 23,000 a day. Well, to talk more about the situation there, we're joined by DW correspondent William Glucroft from Berlin. Tell us, how are the countries now handling the reports of a new strain of coronavirus that's been reported from the UK?
That's right. This new mutation was met with a lot of panic and chaos over the last several days here around the EU, when the United Kingdom announced a harder lockdown for parts of its country that's been dealing with this mutation that initial research shows could be as much as 70% more infectious. Now, Germany and other member states put in an immediate travel ban, much like what we saw in the springtime with chaos at cross-border areas and traffic going back and forth. Now, since the EU has backed away from that blanket ban, the EU saying that's not necessary. France has loosened up its travel restrictions a little bit, but Germany is sticking with theirs, saying that there will be no incoming traffic from the UK until at least January 1st for some people, and a more general loosening by January 6th. And already on the weekend, we saw how much confusion there could be with border police separating people arriving at the airports based on their nationality and their residency status and whether they could prove that they were negative for the virus. Some people having to sleep overnight in airports until they could get a negative test the next morning.
All right, and what does Christmas now look like where you are?
That's right. Christmas is the big question. Of course, people want to meet with family and friends. Public health authorities are saying, please don't do that. Please don't travel. Even though the rules technically allow some meeting of people, health officials are saying it's best if you don't, that you stay away from people at best, meet with them outside and in the smallest possible numbers, because there's a big fear that there's going to be a major spike in cases after the Christmas period. We're already seeing 20 to 30,000 new infections a day in Germany. More than 28,000 people, or soon there'll be 28,000 people dead from this virus in total, with almost 2/3 of that coming in just this last wave of the virus. So Germany not handling it this time around as well as they were applauded for in the springtime. Even with less traffic and people saying they will mostly stay home and meet with fewer people, there are still people meeting, and that is likely to see more cases in the days ahead.
Now, we do know the EU's body has approved the vaccine for all the countries there. So what happens now?
The EU did finally approve its vaccine, the BioNTech-Pfizer vaccine, a few weeks after the US and UK and other countries did the same for their populations. That means here in Germany, according to public health officials, as early as the 27th of December, just after Christmas, the first vaccinations can take place, but it is going to be a long road. Of course, like in many other countries, the most at risk, the most vulnerable will be getting the vaccines first. That's as many as 8 million people in Germany, according to the health ministry here. And there's going to be very few vaccines to go around, less than 500,000 in the first batch. Jens Spahn, the health minister, hopes there'll be 1.3 million doses by the end of the year. And coming in January, the EU is expected to approve the Moderna vaccines. Then there'll be 2 vaccines available for vaccinations. But health officials and public officials are saying it's still a long road ahead. It's going to be a very dark and dangerous winter, and it'll be many, many months until the hardest hit groups, and especially the general population, are vaccinated.